Sierra Leone is currently grappling with a severe public health crisis. The number of Mpox cases is escalating at a truly alarming rate. Since the beginning of 2025, official figures indicate that over 3,011 individuals have been infected with the virus. Tragically, this outbreak has already claimed the lives of 14 people nationwide. The situation is deteriorating rapidly, evidenced by a staggering 50% increase in reported cases within a mere 10-day window. This rapid and relentless spread underscores the urgent necessity for immediate, comprehensive, and effective public health interventions to bring the outbreak under control. The Mpox virus demonstrates a concerning ability to spread, having now infiltrated every region of Sierra Leone. All 16 administrative districts across the country are reporting active infections, illustrating the pervasive nature of this outbreak. The western regions, particularly the Western Area Province, which encompasses the densely populated capital city of Freetown, are currently experiencing the highest concentration of cases. This focus in urban centers presents considerable challenges for containment efforts. The identified viral strain is Clade 2b, the same variant responsible for recent global outbreaks, making international research relevant but also highlighting the pressing local emergency. In response to this escalating crisis, and the overwhelming demand for patient care, Sierra Leonean authorities have been compelled to take extraordinary measures. A police training center located in Freetown is currently undergoing rapid conversion. This facility is being repurposed into a dedicated 400-bed treatment center specifically for Mpox patients. This significant undertaking vividly illustrates the immense pressure being exerted on Sierra Leone's existing healthcare infrastructure. It serves as a stark indicator that current resources are stretched to their absolute limit, signaling a critical need for expanded capacity. This acute local crisis in Sierra Leone is unfortunately reflective of a broader, deeply troubling trend of Mpox resurgence across the African continent. The nation was recently added to the Africa Centers for Disease Control and Prevention's list of most affected countries, a designation that highlights the severity of its outbreak on a continental scale. In one recent week alone, Sierra Leone accounted for half of all newly confirmed Mpox cases throughout Africa. Furthermore, the country reported a shocking 71% increase in its own case numbers compared to the preceding week, averaging approximately 100 new infections each day. To effectively combat this outbreak, it is crucial to understand what Mpox is. It is a viral illness caused by the monkeypox virus, which belongs to the orthopoxvirus genus in the family Poxviridae. This is the same family of viruses that includes the variola virus, which causes smallpox, although Mpox symptoms are generally less severe. Common initial signs of infection include fever, intense headache, muscle aches, back pain, and swollen lymph nodes, followed by the development of a characteristic rash. This rash often begins on the face before spreading to other parts of the body and can look like pimples or blisters. The global health community remains highly vigilant regarding Mpox. The World Health Organization declared Mpox a global health emergency in 2024. This declaration was prompted by its widespread and increasing transmission across many parts of Africa, a trend that has been evident since 2022. Across the continent, since the start of 2024, an alarming total of 129,711 Mpox cases have been reported by 24 affected African countries. Among these, 29,609 have been laboratory confirmed, and tragically, approximately 1,751 deaths have been associated with the virus during this period, painting a grim picture of its impact. Sierra Leone is not battling this surge in isolation. Several other African nations are concurrently experiencing significant Mpox outbreaks, placing immense strain on their respective health systems. Countries including the Democratic Republic of Congo, Rwanda, Tanzania, Burundi, and Kenya are also reporting high case numbers and struggling to contain transmission. Complicating the continental response is the circulation of different strains or clades of the virus. For instance, the DRC has been contending with both clades Aya and Ib, while Uganda has primarily detected clade Ib. Sierra Leone, as previously noted, is dealing with clade the Seger-B. It is important to remember that while the initial global alarm concerning Mpox in 2022 largely focused on outbreaks occurring outside of Africa, the virus itself never truly receded from the continent. Instead, it has continued to spread, adapt, and evolve, particularly within various African regions. This persistent and often underreported transmission has contributed significantly to the current critical situations being faced in numerous countries, including the dire circumstances in Sierra Leone. The sustained effort required to effectively combat this resilient virus cannot be overstated, demanding ongoing international cooperation. The government of Sierra Leone responded with notable swiftness as the scale of the Mpox crisis began to emerge. The nation's Minister of Health, Dr. Austin Demby, took the decisive step of declaring a public health emergency. This declaration was made immediately following the confirmation of the country's first Mpox case, which was officially recorded on the 10th of January, 2025. This early action was critically important, aiming to mobilize essential resources promptly and to focus national attention squarely on the rapidly developing threat posed by the virus. It laid the groundwork for the country's ongoing efforts. Vaccination campaigns are a key component of Sierra Leone's strategy to protect its population and curb the outbreak. To date, nearly 24,000 individuals have received an Mpox vaccine. Healthcare workers have been rightly prioritized in this initial rollout, accounting for almost 60% of those vaccinated, given their high risk of exposure. Other targeted groups for vaccination include known contacts of confirmed Mpox patients and individuals residing in areas identified as high risk for transmission. The country has received over 61,000 vaccine doses, a welcome development, though significantly more will be required. Despite these dedicated efforts, Sierra Leone is encountering formidable challenges in its fight against Mpox. The national healthcare system is severely overstretched, struggling to cope with the influx of patients. At the outset of this current surge, there were only 60 dedicated Mpox isolation beds available across the entire country. This profound shortage of appropriate facilities means that a significant number of active cases, estimated to be around 800 individuals, are currently being managed through home-based care programs. This situation is further compounded by low public compliance with recommended home isolation protocols. Further complicating an effective response are persistent issues related to disease surveillance and diagnostic capacity. Current surveillance mechanisms are predominantly passive, meaning that cases are often only identified when individuals with symptoms choose to seek medical care. This approach contributes to a very high test positivity rate, frequently exceeding 50%. Contact tracing efforts are also struggling to keep pace, with fewer than 1 in 6 confirmed cases having their contacts successfully identified and monitored. Furthermore, genomic sequencing rates are critically low at less than 1%, far below the recommended 5%. Looking towards the future and aiming to bring this severe outbreak under control, the most immediate and pressing requirement is a significant increase in the availability of Mpox vaccines. Securing a much larger supply is absolutely critical to protect a greater proportion of the population and effectively slow down transmission rates. The Africa Centers for Disease Control and Prevention is a strong advocate for this, consistently highlighting the urgent need. They are also championing the development of local vaccine manufacturing capabilities within Africa to ensure equitable access. In parallel with enhanced vaccination efforts, a fundamental strengthening of national surveillance systems is paramount for Sierra Leone. The country must urgently transition from its current, predominantly passive surveillance model to a more robust and proactive approach. Active surveillance involves systematically searching for cases within communities, including screening and testing in high-risk areas, rather than solely relying on patients presenting at healthcare facilities. This strategic shift will provide a more accurate and timely understanding of the outbreak's true scale and help identify emerging hotspots more rapidly for intervention. Improving both contact tracing efficiency and genomic sequencing capacity are also vital components of a successful long-term strategy. Thorough and rapid contact tracing is essential to break chains of transmission by quickly identifying individuals who may have been exposed to the virus, allowing for timely advice, monitoring, or quarantine. Enhanced genomic sequencing will enable scientists to track any viral mutations, understand the specific transmission dynamics of the Clade 2b strain circulating in Sierra Leone, and inform public health strategies accordingly. Dr. Ngashi Ngongo of the Africa CDC has repeatedly emphasized these critical needs. Ultimately, it is clear that Sierra Leone cannot overcome this daunting crisis in isolation. Sustained and coordinated support from both national stakeholders and the broader international community is absolutely essential. This support must manifest in various forms, including crucial financial resources, the provision of technical expertise in epidemiology and outbreak response, and logistical assistance for vaccine distribution and healthcare provision. Furthermore, robust community engagement initiatives will be vital to ensure that public health messages are widely understood, trusted, and acted upon by the population. This collaborative effort is paramount.